Tonight is March 25th. Thanks for coming tonight and listening to our webinar this evening. Tonight, we're happy and honored to have two presenters instead of our typical one. First off, Dr. Jack Taunton, who I think is well known to most of us in podiatry in Vancouver or BC. And Jack's history in sports medicine in BC in particular, if not national, is well known. So Jack, happy to have you here. And with Susan, who is the inventor and patent holder of the ThermaWedge, which is the device we're going to learn about this evening. So thank you both for coming tonight. And you can see the topic of discussion tonight here is a comparison of the ThermaWedge versus stretching for treatment of plantar fasciitis. And I believe it's compared in a randomized crossover study. The objective is essentially to compare the effectiveness of this device. So I'm not going to get into it too much because I don't know a ton about it. I'm going to turn it over to Jack and Susan to tell us more about this device, and I'm happy to learn. So Jack, I'm going to turn the show over to you, let you share your screen, and the floor is yours.
And thank you very, very much. And I'll just go over to the PowerPoint presentation. I'd like to thank, as Howard had indicated, Sue and her husband Doug for the design. Michael Ryan, who is my coordinator of research, and myself did the design and the research. We had a tremendous research team, and Howard, thank you very, very much for getting us all coordinated. As we know, plantar fasciitis is a huge problem. In British Columbia, it's the #1 cause of overtime. And they've, not this study, but WorkSafe have supported other studies with us because of the cost of plantar fasciitis. The estimates are that in a lifetime, 10% of the North American population suffer from plantar fasciitis. There was a large study done from 1995 to 2000, and there were over 1 million visits to either family physicians or podiatrists for plantar fasciitis. There was a large study that many of you have read for individuals working in supermarkets, and for those that were standing on hard surfaces, there was a 300% increase. And similarly, another large study done in the automotive industry, and for those that were more at a sedentary seating position as compared to those that were standing working on the cars, there was the increase went from 50% to 300% itself. So the ThermaWedge itself is a device that Susan has developed, combining both stretching, the impact of heating to warm up the foot, and cold, stretching, and massage. And we'll go into further details in a few moments. As Howard had indicated, the objective was to compare the effectiveness of a novel patented device which combines calf muscle and intrinsic stretching with deep plantar massage and hot and cold therapy against a classic standard calf stretching therapy program that we're all familiar with and have recommended. All procedures were approved by the Clinical Research Ethical Body at the University of British Columbia, where both Michael and I work. Michael also works as a scientific advisor to Kintec, and we do considerable amount of research on injury prevention. I've done that for 30 years. the design. It's a 6-week randomized crossover design trial investigating the effectiveness of the patented ThermaWedge versus a traditional calf stretching therapy. And there's a 1-week washout period of no activity in that period. The setting, was an outpatient sports medicine facility with individuals that have been referred to the Alamogavin Sports Medicine Center with a diagnosis of plantar fasciitis. The eligibility criteria: a minimum of 12 months of inferior heel pain. The reported minimal heel pain on a 100 millimeter visual analog scale had to have been at least 20 millimeters, representing the degree of heel pain. And the pain is identified through direct palpation of the medial calcaneal tubercle or the proximal plantar fascia, as you would do in your practice. Exclusion: corticosteroid injection for plantar heel pain within the previous 6 months. Current skin or soft tissue infection near the plantar fascia. A history of inflammatory or arthritic disease. A diabetic. Previous local trauma. A history of local trauma, and other musculoskeletal condition that might impair function of the foot itself, because we will be assessing the foot function. And involvement in litigation for their heel pain or on a workers' compensation. The participants, there were 29 men and women diagnosed with plantar fasciitis, and that there was an initial information workshop. Informed consent was signed, attained, and any questions answered. It was randomized into 2 groups: the ThermaWedge followed by calf stretching, and the second group, calf stretching followed by the ThermaWedge, with the 1-week window of the washout period between. Treatment interventions employed daily for a 6-week period with this 1-week washout period. They were switched to the other therapy regime, and online log was submitted on a weekly basis, and email was continuously on a weekly basis in terms of their pain, their function, any change in status, skin irritation, or anything like that. The ThermaWedge itself, and we saw a picture of that before, it's light, it's less than 0.45 kilograms or a pound, has a washable, non-allergic, and BPA-free EVA foam board. There's a natural, sustainable Portuguese cork roller with beveled ends, and the hot and cold gel pack. And during the exercise, the gel pack is cold. The individual can elect, if their foot feels stiff, they can elect to have a 30-second warm-up with the gel pack itself. And the heel pad is non-latex comfort heel pack. The participants performed 2 repetitions of the following 5 exercises on each foot twice daily. Once in the morning, once in the evening. The exercise was sustained for 30 seconds and for a total of 1 minute per exercise. A total of 10 minutes to complete the exercise regime on both feet. The exercise in terms of the everyday a calf stretch, first set with the knee straight and the second with the knee bent. And that would allow, of course, both stretching the soleus and the gastroc to be stretched. And that stretch, as we indicated, is held for 30 seconds. The cooling and the warming calf stretch, a frozen gel pack is inserted into the ThermaWedge device pocket and repeated the same calf stretching. The targeted plantar fascia stretch with the toe dorsiflexion, the cork roll is placed under the dorsiflexed great toe, and the position of the roller under the toes to stretch the plantar fascia and the calf simultaneously. For the foot intrinsic muscle massage, the cork roller is placed on a flat surface. The foot is rolled forward and back over the roller to stretch the plantar fascia. Again, this occurs for 30 seconds, and it's applied as much pressure as was comfortable to loosen the plantar fascia itself. The plantar fascia massage, the participants sat and positioned their foot so that they could reach the bottom of their foot with the cork tool in their hand. The toes were pulled back, the tool was firmly held, and the round end was pressed into the sole of the foot. The tool was moved slowly from side to side across the plantar fascia. Again, these exercises are all 30 seconds. Now, in terms of the control intervention, and that was the calf stretching, and the individual would stand in front of a wall or table, split their legs forward, back with their feet shoulder width apart. The front knee is bent. The first exercise, the knee is kept straight. And in the second exercise, the knee is bent, again to stretch both gastroc and soleus. They completed 4 sets of stretching on each leg, hold for 30 seconds. Stretches completed twice daily, once in the morning and once in the evening. The main outcome measures was the foot and ankle disability index, and I'm sure majority of you are very familiar with the foot and ankle index, disability index. And if not, I have a copy on the next slide, and that related to both the foot and ankle conditions, numerical rating scale of the worst pain scores, and assessed weekly over a 13-week period with a survey tool from UBC. So this shows us the foot and ankle disability index. 0, unable to do, 1, extreme difficulty, 2, moderate difficulty, 3, slight difficulty, and 4, no difficulty at all. And this is done standing, walking on an even ground, walking on even ground without shoes, walking on an uneven ground with shoes, stepping up and down curves, sleeping, walking initially, walking approximately 10 minutes, and the score from that, and home responsibility, has that been affected by the heel pain? Personal care, has that been affected? Heavy work, pushing, pulling, climbing, carrying, is that affected? Walking up hills, walking down hills, going upstairs and downstairs, squatting, coming up onto the toes, walking 5 minutes or less, walking 15 minutes or greater, and the score, activities of daily living and light to moderate work, standing, walking, and recreational activities. Again, the pain is related both to the foot and ankle. And as we had indicated, 0 was unbearable, 1 severe pain, 2 moderate, 3 mild pain, and 4 no pain at all. With the results over the 13-week protocol, there was a significant difference in both the reported worst pain and the foot and ankle disability values with the control and the treatment phases. The ThermaWedge phase reported lower plantar pain and improved foot and ankle function compared to calf stretching, and with a reduction in the worst pain and an improvement in foot and ankle function as indicated by the foot and ankle disability index. So if we look here, we have the two groups. The solid group is first with the ThermaWedge. So at the worst pain, that was 5.5. And then at the crossover, the pain had reduced to 4.2. And then they went into calf stretching. With that, you would see that the pain increased and then a slight drop. The calf stretching group, they started at a higher level of 6.3, continued and increased to over 7, just over 7. And at the crossover at 7 weeks, slight decrease in worst pain. And then as they switched to the ThermaWedge, you could see a significant reduction in the amount of pain as they were utilizing the ThermaWedge itself. So that you can see with the ThermaWedge, there was a reduction in the worst pain. And then you could see the change as it switched to calf stretching. And with the calf stretch ThermaWedge group, once the introduction of the ThermaWedge group, there was a significant reduction in the mean worst pain. The objective of this study was to compare the effectiveness of a device designed to assist administering stretching and self-massage, temperature therapy compared to a standard of care protocol of calf stretching. There has been limited formal investigation of the effectiveness of an exercise-based intervention for plantar fascia, despite it being the mainstay of therapy for this condition. There's a need for a formal documentation of an exercise and physiotherapy protocol program treating plantar fasciitis, and to show evidence supporting, especially for workers who stand for prolonged periods of time. And the results from this study suggest that using a multi-element device to assist rehabilitation exercises for plantar fasciitis provided a measurable improvement in symptoms over the typical stretching program. A previous case report on a directed program of targeted exercise to increase range of motion and progressive sport-specific stress on the plantar fascia reported favorable clinical outcomes. And lastly, the hot pack was used to assist in tissue preparation, and the cold pack feature was used to provide pain. In conclusion then, the individuals with plantar fasciitis appeared to experience a significant improvement in pain and an improvement in foot and ankle function when they utilized the device and the combination of the device and the exercise protocol versus a calf stretching alone. Further study is merited to confirm the significance given the relatively small sample size. And with that, we will open up for the audience.
So if you do want to contact Susan, you have a question about the device, you want to get a demo in your office, shoot her an email. She's fast on the reply. And like I said, I'm sure she'd be happy to come by and show it to you in a little more detail and specifics. If you forget her email address, just contact the BCPMA office, and then we'll provide that to you, or send me an email and I'll give it to you as well. Jack and Susan, I do want to thank you for your time tonight. We appreciate you taking the time to do this with us and for us. It's always nice to get your input on novel devices that affect the foot that can help our practices. So again, thanks for your time. We appreciate it. And Susan, I will ask you to drop on me also one of those pads when you get a chance.
You bet.
No rush though. But
All the best now. Goodbye now.
All right. Have a good night, everybody.
Good night.
Have a good night, everybody, and we'll see you all hopefully next week. Have a
Thank
good
you.
night.